the personalised care team at Healthy London Partnership. And I'm helping to shape the Social Prescribing Innovators programme with my colleagues Jenny and Liana. So Jenny, Liana, do you want to just briefly introduce yourselves?
Hi everyone, I'm Jenny. I'm the Health Inequalities Project Manager in the team with Molly and Liana. I'm leading on the Innovators programme, and when I'm not doing that, I'm working mainly with PCN to support the embedding of social prescribers, health and wellbeing coaches and care coordinators. Nice to see you here today.
Hi everybody, it's really lovely to see so many familiar faces and names. I think most of you know me. I'm Liana Martin and I work in the social prescribing team in London and oversee a number of the projects, and this really was this project came from working so closely with many of you in peer supports and really unpicking some of the challenges that you face on a day-to-day basis. So I'm really excited to be here today.
Thanks both. So, okay, I think we'll get started. Could we get the agenda up, please, Jenny? Okay, so I'm just going to briefly run through the agenda for the session today. So, firstly, I'm going to talk a bit more about what the programme is, so the background and the goals and the desired impact, and then a bit more information about what the programme will involve, so the offer of support and the timeline, so how that will fit into your work. And then there'll be a short opportunity for questions after that as well. We're then going to move into a more collaborative, interactive part of the session. So Charlie has kindly linked the link to the Jamboard in the chat. So this will be the tool that we'll be using for that session. And Charlie will be leading that. This will be an opportunity for you to crowdsource collective or common challenges that social prescribing face in delivering an impactful service. So particularly related to social prescribing service design or delivery. And it will also be an opportunity for you to sort of unpick and think about the underlying causes and the potential solutions as well. So this will be a really exciting and fun exercise, but it will be a taster of what's to come potentially for successful applicants as part of the programme as well. And then after that, we're going to give a bit more information about the application, so what you want to start thinking about at this stage, what will be involved as part of the application form, what questions are involved, sorry, and the eligibility and criteria for applicants, more about the funding and support with costing up your idea as well. And then there'll be time at the end for you to ask any questions about the programme. So please do ask your questions in this session at the end, as it'll be a great opportunity for others to learn from each of your questions as well. We'll then be developing an FAQ document, which we can share after the session. And then we're hoping to finish 15 minutes early today. So we've got rid of a short break in the middle just to allow us to do that. But do feel free to get up at any point, move around, go make a hot drink, whatever you need to do. Next slide, please, Jenny. So the purpose of the session today. So we asked and you answered what the main thing you'd like to get out of this session would be. So we grouped your responses into the main themes. So these included more about the application criteria, so what makes a good applicant, the application questions involved, the process and tips for strong applications, support with breaking down the funding that you'll need for your idea, some space to discuss suggested or common challenges as well as potential ideas for innovation, and more about the programme logistics and what's involved for successful applicants, and the support and coaching offer available as well. Next slide, please, Jenny. Thanks. So yes, I just saw a question about whether it will be recorded. So the session is recorded. So we'd love it if you keep your cameras on throughout the session, but obviously if you don't feel comfortable with the recording, that's absolutely fine. Please also keep yourselves on mute throughout the session, unless you're speaking up. And if you do wish to speak up, you can raise your hand using the Teams function, or you can pop it in the chat as well, and Jenny will be monitoring the chat throughout. Also, please do keep your phones on silent if possible, just to make sure that we don't have any interruptions. Next slide, please, Jenny. Okay, so what is the Social Prescribing Innovators Programme and why are we doing it? So we know that social prescribing has been a huge cultural shift for primary care, and there's been huge achievements across London in embedding social prescribing within primary care. But we also know that there are huge challenges that you face in delivering an impactful service, in particular relating to mainstreaming social prescribing, so promoting the recognition and the value of it, particularly in PCNs, ensuring that the support goes to the right people, and in making social prescribing more sustainable. So we believe that those people working on the front line within social prescribing are the best placed to and have the best insights into the challenges that you face. And we want to empower you to really be able to think about those challenges and come up or explore potential solutions that can help to overcome them. So we want to be able to give you tools, a bit of money, and a peer group that you can collaborate with to really think about the underlying causes or the underlying issues underneath these challenges, and then brainstorm potential solutions to them as well. So this is a pilot programme. We will be offering a fund of up to 10k to each of the successful participants, whether that's individuals or groups. But it's not just about the funding. So successful applicants will also benefit from a 6-month programme of support between September 2022 and February 2023. And this will help you to deliver your projects against your specified challenge. So this may involve implementing a social prescribing service design change, carrying out a local pilot to test systemic solutions to systemic challenges, or developing solutions to specific priorities within the NHS. And then we've given some key resources there as well. So the online application form is linked there, which went online on the 22nd of June, and it's open until the 20th of July. The information for applicants, so that's a slide pack that we've created with more information. Both of these are also available on the HLP website. And as I mentioned, we're also developing an FAQ document, mostly based on the questions that you've asked today. And we'll be sharing this with you next week. So as I mentioned, successful applicants will benefit from up to 10k grants going towards innovating against their specified challenge. But it's not just about that funding, it's also about the programme of support offer that we're expecting participants to become involved with. So this will include one-to-one coaching, project and development support, and it will take a continuous or quality improvement approach. So this is a problem-based approach, really thinking about the underlying causes of your challenge and then brainstorming solutions. So Charlie will give you a bit more information about this later in the session as part of the interactive exercise, and this will give you a taster as well of what Charlie will be helping to support you with as part of the training if you were successful. So this is a pilot programme, so we're hoping to have 10 to 12 projects tackling challenges to effective social prescribing. We're hoping to gain better insights into the challenges that are faced by social prescribing services, and to share innovative work at the end with other social prescribing services. For example, this may include case studies or resources. We're also hoping to potentially develop a toolkit which we could then share with ICSs to run similar programmes in future. So the overall desired impact is that we want social prescribing to be better embedded and more sustainable. We want to empower you to provide an impactful service to London's most disadvantaged communities and we want to develop a collective of leaders working within this area who can demonstrate this impact. Next slide, please, Jenny. Thanks. So, as part of the programme, if you are successful, you will be granted up to 10k, but you'll also be expected to take part in the monthly training sessions. So this is the core part of the programme. So this is quality improvement. And as I said, Charlie will give a bit more information about what this is later. But it's taking a problem-based approach. We'll also be offering skills share sessions. So this will be an opportunity for you to share your learnings with other programme participants, peer consulting group sessions, one-to-one coaching sessions. So we're going to make sure that every project involved has access to one-to-one coaching experts. Board check-in sessions. So this will be an opportunity for you to present on your project progress to the decision-making board. And I'll give a bit more information about who these people are in the next couple slides. And then finally, monthly drop-in sessions, which will be run by HLP. And this is just an opportunity for you to come in, interact with your programme peers, and also ask any questions that you may have throughout the programme. In addition, we'll be creating a WhatsApp group where you can network with other people on the programme more easily. We'll also link you in with any ad hoc support, for example, particular people with particular expertise that may be related to specialised topics on your project. Next slide, please, Jenny. Okay, so as mentioned, there is also a time commitment involved. So this table just shows when all of the different sessions as part of the programme will occur. So we're aiming to kick off the programme in August with a pre-meet, and this is an opportunity for you to meet everyone that's also on the programme, network, and just get a bit more of an idea of what's to come. We're then going to commence all of the content, so the main training sessions in September, as well as the monthly peer support sessions. Peer consulting group sessions will be happening bi-monthly, one-to-one coaching also bi-monthly, as well as skills share sessions every other month. And finally, the board check-in meetings where you can present to the decision-making board. This is all with a view to you presenting and sharing the success of your projects. So really thinking about sharing the learnings and the results and your achievements at the end of March. Next slide, please, Jenny. So this is a bit more information about who is on the decision-making board. So this is a group of people, a panel of experts that we've brought together who will help to support with marking your applications. They will also be there to provide any additional support or guidance to those who are successful in making it onto the programme. They will also be able to connect you with other people in their network as well, depending on the requirements of your project. So they have a wide range of expertise on the board, ranging from social prescribing, innovation and academia, amongst others. But just to note as well, if you do have any relationship or know anyone on the board, this won't influence or impact your application. We do have a conflict of interest form that can be filled out. Next slide, please, Jenny. Okay, so just briefly, here are some dates before the programme for your diary. So as I mentioned, the programme with all of the guidance and the application form launched online on the 22nd of June, and it will remain open until the 20th of July at midnight, which is when it will close. We'll be releasing the recording from this workshop next week. Once the applications close, there'll be a short clarification period before we communicate out the outcomes on the week commencing 8th of August. Also, there will be an opportunity to request feedback on your application if you wish to. And then for successful applicants, the deadline for accepting your offer will be the 15th of August. We're then aiming to launch the programme at the beginning of September, wrap up at the end of February, and then showcase all of the projects, as I said, across London in March 2023. Next slide, please, Jenny. So before I move on, I just wanted to ask at this stage if anyone has any questions. Feel free to put your hand up or speak up. I'm just going to read through the chat.
I don't think there are any questions in the chat.
Okay. Does anyone have any questions at this stage? Don't worry if you don't, there will be opportunities at the end as well. Okay, well, that's absolutely fine. Before we just move on to the, before I talk more about, oh, sorry, I'm seeing some questions.
Sorry, I do have just one question.
Yep, go ahead.
Do you know how many, what your pot is, how many grants of 10,000 you are likely to give out, so that we have a sense of, you know, scale of application versus availability of fund?
So we don't know at this stage. We'll be giving out, it's a fund up to 10k, so that will really depend on the requirements of your project. And we're aiming for about 10 to 12 projects. Sorry, Liana, did you have your hand up? No. So that will be the maximum that we can give out. There's also, Liana will go into a bit more detail about this later, but there is ring-fenced funding for challenges related, or applications that are focusing on challenges related to recruitment and retention. So around 6 of the we're aiming for around 6 of the projects to be focused on that, and the other 6 to be focused more around other challenges. But we do also have 2 key priority areas, access and impact, but Liana will give a bit more information about that later. But yeah, basically in terms of the funding, it can be up to 10k, but it doesn't necessarily mean that all projects will receive this. It really depends on what the requirements of your project are. Does that answer your question?
Yeah, that's great, thanks.
Okay, great.
Just seen there's one question in the chat from Amy saying, is it possible to share attendance of the session amongst 2 project leads? Do you want to take that, Molly?
Yeah, I mean, I think as far as I'm aware, it is possible to do that. If you have 2 project leads, you can then share the attendance. So on a previous slide, we did show who part of the group needs to come to each sort of part of the programme offer of support, so the different sessions that we're running. So if it's something where it's the project leads only, then yeah, you can share that across 2 project leads if you do have 2 on your project.
We've also got a question saying, does it need to be a brand new project or can it be something pre-existing?
So it needs to be something, it can be an idea that's already worked on before, so it doesn't need to be a completely novel idea, but I think it does need to be a brand new project. For example, we won't fund any costs that have already been made towards something else. Liana or Jenny, do you want to input anything on that?
I think it's important to highlight that we're asking you to come with a challenge that you want to innovate against, and you might have a few ideas about what the solutions might be, but the process of the programme will support you to trial those solutions or implement 1 or 2 of those solutions, and they might be, you know, might have been done before in different contexts, they might not have been, but yeah, we really want you to encourage you to think about what are your key challenges rather than what are some projects you want to try. I hope that makes sense. We've also got a question, can you put in more than 1 application?
I mean, could you give a bit more detail about why you would? So are you hoping to put in more than one application that are focused on multiple different challenges? Because if you were, then as part of the questions, there is an opportunity for you to list more than one challenge within that. So if you do have a couple challenges that you think are really key, and really sort of really important and influencing your social prescribing service and your ability to deliver an effective an impactful service, if there's more than one, then you can include multiple challenges within your application. So if that's the reason for making multiple applications, then I would advise just putting in one and just talking about more challenges.
Okay, yep, that makes sense. Thank you. I think that was it. You're sort of saying that there's various areas that we can make applications under if you're looking at impact access training. So it's just saying, yes, do you need to put them all in as one and recognise that, or can we, if they obviously approach it from quite singular angles within the service provision available at the moment, would that constitute separate applications? So, but I think what you're saying is no, try and embed it all in one application.
Leanna, did you have something to input on that?
Well, I was going to say, if the projects are very different, I mean, I think if you feel like there are two things that are wildly different and you would like to do one or the other, then maybe it's worth noting on your application that you're making a separate application if you feel that you're going to have wildly different answers on each of those applications. I think the truth is that we're unlikely to grant more than one. So having the separate applications would be purely to ensure that you're giving justice to each of those challenges that you're wanting to address, rather than having the potential of getting onto the programme twice, if that makes sense. Because you're going to
absolutely, yeah. No, it wasn't really about trying to get onto the programme twice. Actually, it would just be with regards to, I suppose, opening up opportunity so that it really is given out under that criteria. You know, it might be that one area is not deemed to require, but one would be. Therefore, we would have better opportunity by putting in separate applications, as you say. But I think it comes down to us looking at and addressing those challenges and working out in our own sense where that's best approached from.
Yeah, no, I think, thanks, Leanna. I think, as Leanna says, obviously, if they are widely different, the application form, it asks about the challenges, so you can give more than one challenge, but then it does also ask about you to brainstorm and think about potential solutions. So obviously, if all of the solutions to the two challenges you give are going to be really, really different, then yeah, I think best to put in two separate applications. But if the two challenges are more similar and you can sort of group together the solutions as one, then put them all into one.
Great, thank you.
Are there any other questions?
There's just one last one in the chat, and then we can go to Michael, who's got the hand up. Amy asked if their service, so Hammersmith and Fulham, also applied, if two people applied, for example, would you only choose one of them?
Yep, thanks, Amy. So we are looking for a geographical spread across London, but if both applications are really, really good and they meet all of our marking criteria, then no, we're not limiting ourselves to just having one group from different boroughs. So no, that's not going to be a priority. But yeah, overall, we will be making sure that we're trying to get a geographical spread across London. And if this does mean sort of making more outreach further down the line, then that will just mean we'll do that. But we won't have to pick one particular place from each borough, one particular group from each borough. Michael, you also had a question.
Thank you. Yeah, in one of the previous slides, it said that this is for individuals and groups of social prescribers. So individuals like myself who have an interest in the sector, who are not social prescribers, will we be eligible for this award or not? Could you clarify that for me, please?
Yeah, sure. So you do need to work directly. You need to have a direct link to social prescribing. So If you work directly with the social prescribing service, then that's fine. You can apply as an individual, but you need to demonstrate in your application that you do work closely with social prescribing. Leanna, sorry, did you want to add?
Yeah, hi Michael. I think the types of people that might be directly related to the social prescribing service might be a training hub or a commissioning service, or perhaps a GP federation or a voluntary sector organisation that host the link workers. So I think it would be somebody that's got a really good understanding of the challenges of implementing and delivering social prescribing within primary care. So yeah, there's we'll talk a bit more about the criteria later. Obviously, there's lots of challenges that sit outside of delivering the social prescribing service that pertain to the sustainability of social prescribing, for example, the provision of services that social prescribers refer on to. But that's not really what this fund is about, really. This is more about thinking about some of the systemic issues that are maybe holding social prescribing back, making it a bit of a challenge to embed it within primary care and make sure that it's reaching the right people. And that's what this is about, really. And so it's people that are delivering that service or are charged with ensuring that it's embedded and sustainable.
Thank you for clarifying.
Thanks, Leanna. So in the interest of time, I'm just going to move us on. There will be opportunities at the end as well just to ask any more questions. But before we give a bit more information about the application guidance, questions that will be involved, and sort of success criteria, eligibility, as Leanna mentioned, we're just going to move on now to the interactive part of the session. So we have already linked the Jamboard in the chat, but we can also link this again. But this is the tool that we'll be using. And basically part of this interactive session, so this will be led by Charlie. This will be an opportunity, as I mentioned at the start, for you to really sort of think about the key challenges that are facing social prescribing services and preventing them from delivering an impactful service. So really relating to social prescribing service design or delivery, as Leanna mentioned, it's not all about, it won't be about particularly funding the voluntary community care sector organisations that social prescribing refer onto. Although we appreciate that this is a huge challenge, this is more focused on the social prescribing service. So this will just give you a bit of a taster of the core programme of support, the training that will be involved, which will be supported by and run by Charlie for successful applicants. So it will be a really great opportunity to take part in this, as it will also help to support you with your application as well. But yeah, so I'll just hand over to Charlie now.
Hello, everyone.
That's okay.
Hi there. Okay, and should we link to the Jamboard, Jenny? Is that okay? And we can share that. So I'm Charlie Kennedy Scott. I didn't realise until I thought about it this morning, I've worked in the NHS for over 20 years, and I don't quite know why I hadn't realised that, but it's quite a shock to realise it's so long. And in the last 7 years, I've been doing quite a lot of quality improvement in my various different jobs. The most recent of which has been the last couple of years. I've been a programme lead for the Digital Accelerator in North East London, working on trying to improve access to practices using appointment systems and so on. So we've got a challenges session now. If we move to the next link, so the next slide, Jenny. For the first few minutes, we'll look at what quality improvement is, and then we're going to ask all of you for some challenges, and then we'll pick a challenge that from the room, understand what's going on with it, and then we'll turn some of the challenges that come up from that into some potential solutions. But first of all, from all of you here, and there are a lot of you, does anybody know, or would anybody like to say what they think quality improvement is? And you can put it in the chat, or you can put your hand up and we'll hear from you live. So any hands up, anything in the chat? Don't be shy, there are no wrong answers with this question. And I'm going to go silent to force some answers. So what is quality improvement? There's a question in the chat. What's the question? So what is quality improvement? Do you know what it means? We've got improving access to services, okay. And Daphne, Sure. Do you want to say what you think it is? And also, just also to mention, I see people.
Yeah, I just think quality improvement is a process of consistently reviewing your service offer in order to ensure that it is permanently improving based on your learning. I would say it's an ongoing process of checking your service against your outcomes and revisiting and rechecking and touching base, and just, yeah, a kind of continuous process of never just sitting back and assuming that everything's fine because you've done it like that before.
Okay, that's a really good answer. That's certainly exactly one of the things that quality improvement is used for. That's continuous improvement. I think you're describing there. Can I just add something whilst we go? The people have already started putting challenges into slide 6. If you could hold on for a second, we'll come back to that in a second. Is that okay? So don't put the challenges in quite yet. Thanks for that answer. And we've got a few more things in the chat. We've got building on what's already there, creating some standards, problem solving in order to improve services, addressing challenges through solutions, consistency, reviewing based on feedback, so that's improved, efforts to improve. So lots of good answers there. Okay, and has anybody done a quality improvement project that they'd want to give a very brief example of? Anybody done one? The answer says yes there. What was your one about, Imran? Farhana, sorry.
Hi, yes, hello there. I'm the PCN manager for Crest PCN. Yeah, I'm doing one at the moment, actually. I'm meeting with my mentor later in Nelft. My quality improvement is all about continuity of care for patients with 4 or more long-term conditions.
Okay.
So because that's something that the King's Fund had picked up, they had done a 55-page report, and they said it's very difficult to measure, but there's a feeling amongst clinicians that if you see the same doctor and you've got multiple conditions, then that improves the care.
Okay, cool. That's really good to hear. Okay, thank you for
Yeah.
that. Okay, so let's move on to the next slide. And sorry, the next one. Okay, so a lot of what you just said, this isn't the definitive answer on here. This is not the answer to what quality improvement is completely, but a lot of what you've just said is encapsulated in the bullet points on the left-hand side and some of the things that the key things to consider. So what is the success you're trying to achieve? How are you going to go about doing it? And how will you know whether you've made an improvement? And that's when we get some measures in. So we're looking to get aims, measures, and then thinking about new ways of doing things or improving existing ways of changing stuff. The box down the bottom, if we go to the next slide, we get a bigger version of that. So the next slide. So this is the quality improvement journey, otherwise known as the sequence of improvement. So today, what we're going to do is in a minute, we're going to look at identifying a quality issue. So that's the first box. And then we're going to understand it a little bit better. And a lot of the time when people have a challenge or a problem, then we're really keen to jump very quickly to the solutions. When we do that, it's often hard to understand what we're doing. And so whilst it can at times appear a little bit frustrating, it's really important to try and understand what's happening as well as you possibly can. And if you do that, you'll get better solutions, better ideas, a better understanding of how you're going to measure it. And ultimately, the project's more likely to succeed. And then the last thing we'll do very briefly is see if we can come up with a few solutions to the challenge we choose in a minute. So there's been, as Molly said, this is a problem-based approach. It's not just problems though, so problems are also called challenges or issues. One of the things people often forget about quality improvement is that there are opportunities out there as well that we don't necessarily use or exploit or identify. So don't just think of it as a negative, trying to change a negative to a positive. Sometimes it's about trying to find a positive and build on it and make it a lot better, because there's quite a lot of opportunities to find those as well. Okay, so now let's go to the next slide. And this is when we're going to ask you as a room to start putting some challenges in that you're facing. So the challenges that we're looking at here are, what are the main challenges you face in delivering an impactful service? Can people, obviously some people can access the Jamboard because you're already there. We'll put the link in the chat now, which will take you to this slide, hopefully. It's slide 6. If you can't access the Jamboard, then put in your challenges into the chat and we'll copy them across. I'm going to go silent whilst people write their challenges into the Jamboard, and we'll just give you 5 minutes, 4 or 5 minutes to do this, and then we'll pick one and start to understand it a little bit better. In the meantime, any questions from people about how to access this, or can you get into the Jamboard okay? Do you understand the questions? We need to move some of the answers are actually covering the question as well. Okay. So as I say, if you can't access Jamboard, then put your question into the chat and we'll copy it across. Sorry, your challenge into the chat. And don't worry if you think we're going to not have enough space, because we'll move them around and try and create more space for you. And these challenges may be exactly the ones you're trying to get some funding for. So don't be afraid to put those in, or anything else at all. And anybody who can't access the chat and can't access the Jamboard, you could put your hand up, and if you can describe your challenge in a sentence, then I could write it into the Jamboard for you. I think we've just lost something. I'm not sure what happened there. It looks like somehow the whole thing got deleted. That's never happened before.
Try going back. If anyone thinks they might have deleted it, if they press the undo button.
Yeah, or Control Z. There are dangers, aren't there? In face-to-face meetings, you can't have so many people, but no one can delete all the post-it notes off a wall in one accidental press of a button. Online, things are less controlled. So apologies for that, everyone. If people want to if you can remember what your challenge was, maybe just put it back in again, and then we'll choose one in a second. We had a lot, didn't we? So it won't matter too much. The main objective of this is to pick something and work it through as an exercise. Okay. All right, let me give you 1 more minute and then we'll come back and we'll choose one. Okay. And whilst you're waiting, have a look at what's on there and think about if there's one on there in particular that we'd like to try and understand what's causing it, because that's going to be the next thing we're going to do. Okay, all right, let's stop adding them in now and try and choose one. So when we've got a smaller room, we sometimes would do a voting exercise where we'd ask you to choose one via voting online for it. But Does anybody want to shout out? Is there anything on there you feel really strongly we could try and look at in more detail? So, okay, not enough supervision for SPs. That's in the chat twice. I tell you what, are you okay if we go with that one? I think that's let me just write that one in. Okay, so if we go to the next slide, Jenny. Okay. So it was not enough supervision for social prescribers. All right, so this is a fishbone, this diagram here. And you remember in the second box on the sequence of improvement, we get to the section called understanding the problem. And this is the part I said where it's worth spending your time trying to really understand what's causing something to happen. So the idea of this fishbone diagram is that we try and understand the causes of there not being enough supervision for social prescribers. And we're going to break it down into 4 different sections: the people reasons, the process reasons, the information, and that's the environment as well, and systems, and that can be technical. But to give some structure, what we'll do first of all is look at it from a people point of view. Now, yesterday we were thinking about how best to do this and suggesting that people could say things and I could write them in, or you could put them in the chat. It seems like people are actually really well using the Jamboard today. So I think it's worth an experiment to see if we can add in post-it notes. If you all move to slide 7 on the Jamboard, and just with the people to begin with, what are the people reasons that there isn't enough supervision for social prescribers? So if you write in there, what would cause there to not be enough supervision from a people point of view? Does that make sense? And let me say, the first time you ever do a Jamboard, it takes a bit of time to get your head around it. The second time, people go, oh, I like that. Once I understood it, it was really helpful. So don't worry if it feels a bit alien and a bit strange. It's one of those things that after a while becomes really helpful. So lack of time, I'm being very bossy here, but lack of time is that about the people or within the environment? Is that people don't have enough time? And then we've got managers not understanding the emotional impact, okay? Okay, if you want to write anything in the chat, please do, and we'll copy it across. And the one that's about the funding, so that's more probably about the environment and the information. So we'll put that over here for now. That's all right. Okay. And if anybody wants to put their hands up and say something, that's fine. You can dictate it and we'll add it in. Okay, well, we seem to be doing well that with the people part. So now let's look at the processes. So that's the part done underneath the people. So what are the processes that may or may not be working that do or don't contribute towards there being enough supervision? So processes, does that make sense? Workplaces are full of processes. We don't necessarily realize that until we start looking at what's happening. What kind of processes may there be or may there not be that are contributing towards there not being enough supervision? Okay, so no agreed way, okay. And are there processes in workplaces or in between teams? And not to give you any clues, but a lot of the time people talk about variation here. There may be a process in one team that's completely different to a process in another one. Okay. Okay. All right then. And I think so. Let's look at information. So what's the information that's available to anybody involved in this, and what information is available within the environment that people work that does or doesn't contribute towards there being supervision? So I moved the one across for funding. So that's financial money. Obviously, that's not exactly information, but that's the classing the information as the environment area here. And just to help, I mean, a lot of the time information is the one that gets the least filled out, so don't worry about that. Anything around systems. So this may be a technical system. So some big trusts, for example, have built-in supervision electronically that reminds managers to do it every week or every month or so on. Is there anything, do those systems exist, or is there a lack of those? Or again, might they vary across different teams and so on? Okay, lack of training, that's interesting as well. And just a question, so the one that says system to allocate supervisors to SPLWs and book them in, is that there isn't a one, or that the system that does it doesn't work very well? Okay, thank you. It's a strange way of working, isn't it? You ask a question and then a post-it on a Jamboard changes in what's written on there. Okay, access to EMIS. Okay, that's in the chat. Is that where there isn't access to EMIS, or access to EMIS varies or doesn't function well? That's for Hannah.
It's not having access in time, really. So when the social prescriber comes in, it took us 4 months for her to get access to all of the 8 practices. So that's an issue, isn't it?
Yeah, okay, so it's a real technical challenge then. Okay. All right then, so you're beginning to see what happens when we start to understand the causes of any problem or any challenge. We quite quickly build up a very packed fishbone diagram. When you do this live with people and you have a flip chart piece of paper and you have 4 or 5 people around a table, it fills up just as much. So it's always a really good way of doing it. You get all sorts of things that come out that otherwise probably wouldn't come out. And then move on to the next part. So we're going to stop now, and we're going to try and look at these and think, well, what might some solutions be? So if the problem is that there is not enough supervision for social prescribers, what might some of the solutions be that would say now there is enough supervision, or creating enough time for supervision? And if you'll have to memorize this, or you'll be able to look at this slide actually, because we're going to go on to the next slide, slide 8, Jenny, if we can. I'm just going to spend a few minutes. So the question is, what are some of the solutions or change ideas, so things you can do differently for the challenge we just looked at? So if people want to think about some of the things that were working not well, and then maybe flip them around, that will give you some answers or some solutions to some things you might think about changing and doing differently in order to, okay, we've lost the thing again. It's coming back. In order to do differently, to create a project potentially where you go from having not enough supervision to having enough supervision. Okay, so again, if you want to put things in the chat, if you can't access the Jamboard, please do so. Otherwise, just put in some answers into slide 8. And it's always very encouraging to see so many ideas coming up so quickly. And this tends to be what happens when we take this sort of structured approach. Pick a challenge, understand it, and then ask for solutions. And because people have been thinking it through in a structured way, it's much easier to come up with possibilities. To come up with possibilities that can then be turned into things you might try and do differently. And also they tend to be more likely to succeed because they're based on what's happening rather than sort of being picked out of the air, or, and this is one of the important things about quality improvement, not dictated to by the manager or the director, who sometimes feels a pressure on them to come up with a solution to everything. So all we're doing with quality improvement is using it as largely a common sense way of understanding, so picking a problem or an opportunity, understanding it in different ways, looking at the causes, looking at the data, coming up with some solutions, some potential ideas, things we can change, which is exactly what you're doing now. Then we pick a few of those, 1, 2, 3, or 4, work out how we can test them and how we can measure them. Do that, do what are called plan, do, study, act cycles, and then implement the ones that work, change the ones that don't, or abandon the ones that don't work at all, and use that to work towards the aim of the project we're working on. So this is pretty much what you'll be doing if you do quality improvement for your projects. And I'm going to just open it up now for the last 1 or 2 minutes. Are there any solutions on that board that we're looking at right now that you're surprised to see, or that are good, that you would like to see implemented or tried out? Maybe what you could do, if there's anything on there that you think is a good idea, go to the left hand side and you'll see the pen at the top, and maybe just put a ring round it. For example, I'll just put a ring round embed clinical supervision. So put some rings round the ones that you think are good ideas, just to give us an understanding of whether this interactive exercises help come up with some stuff. And the one with the most rings around it will be our top change idea. Apologies, I'm looking up at another screen if I appear to be looking in the wrong place. Okay. So another 30 seconds of putting rings around it, and then we'll end this part. Okay, and it could be the same person putting the rings around things more than once. I realise that, but it looks like the leading ideas here are cross-borough system to share supervisors, train up HI leads across the ICSs to be supervisors, more funding to be allocated, and embedding supervision from the start, and a few others. Okay, so right, brilliant. Okay, excellent. So that's just a taster in quality improvement, with a technical hiccup in the middle when we lost everything, but no worries, we came back from that. Any questions for anybody? Or any comments? Okay. All right then. Okay, so hand back to Jenny, Molly.
Thanks, Charlie. Yeah, I mean, that was a great exercise. I think it was a really good way of just demonstrating, getting a taster of the sessions. Sorry, I thought I'd frozen on the screen then. Of the training that we will be offering as part of the programme as well. So I hope everyone enjoyed that. So we do just have a question there about a lot of the solutions sound great, but how do you actually implement them? So great question. I think that's something that we can support you with as part of the programme. We'll be able to link you in with people on the decision-making board as well, who will have expertise across a range of different areas. And we'll also link you in with lots of other people, including coaching experts. And the core training as well will help to really drive you towards meaningful solutions. But yeah, thank you so much, Charlie. I think that was great. We'll just move back onto the slides now, if that's okay, Jenny. Thanks. So we're going to move on to more about the application. We are just way ahead of time, so I think we'll just crack on and just go ahead without a break. But as I said at the start, do feel free to get up and move around, go make a hot drink if you wish to do so. So yeah, I'm going to talk more about now the application process, the criteria for applicants, and what will be involved as part of the application, the online application, if you haven't already looked through this. So in terms of the process, as I said in a previous slide, the online application has launched online with all of the guidance as well. So this is available on the HLP website, but it's also linked in these slides, which we'll share after the session. This will be open. So this, sorry, just letting someone in. So this launched on the 22nd of June, and it will be open until the 20th of July at midnight. There'll then be a short clarification period where we will mark all of the applications, and then we'll aim to give out all the outcomes of the application, so communicate all of that out in the week commencing 8th of August. There will be also an opportunity for feedback, as I said, for anyone who wishes to request that. And then we're aiming to start the programme, as I said, in end of August, September. So that's just a really brief run through of the process and the timeline. But in terms of the application form, so there will be 4 main sections. So the first section is all about you, your organisation and those who are in your group. The second about your proposal. So really focusing on the challenge, as I said, but also some potential solutions. The third section about the funding and the budget. So what amount you're applying for and why, so giving a bit of a breakdown of what this will be used for. And then finally, the last section is both quantitative and qualitative questions. And this is just to get a bit of a feel of what experience and skills you have as a team or as an individual, having worked on quality improvement projects before. So this is just to guide us in terms of how much support you will need as part of the training if you were successful. There are also some EDI questions at the end of the application as well. And if you do require any further support or have accessibility requirements with the application form, then please do contact us on the email provided there. Next slide, please, Jenny. Okay, so what would an ideal application look like for the innovation programme? So as we've mentioned, we really want to focus on the challenges as part of the application. So we want you to pick a challenge or a couple of challenges, as we mentioned, that you think really impacts your social prescribing service, from being able to have a sustainable workforce, from running effectively and efficiently, from tackling health inequalities, and from reducing pressures on NHS services. So although we're focusing on the challenge in the application, there is also a question and opportunity to brainstorm suggested solutions. But just to note, you don't have to go with any of these particular ones. We don't want you to pick a particular solution at this stage, because as demonstrated in the interactive exercise, as part of the training that's run by Charlie, we will be supporting you to really think from the bottom up about the problem and developing a solution as we go through the programme. So I'm now just going to hand over briefly to Liana, who will talk a bit more about the key challenges that we're looking for as part of your applications and the key themes. So thanks, Liana.
Thanks. So as Molly's explained and we've talked a lot about, this is very much whilst this is not a new idea to invest in frontline staff or people that have got a really good understanding of a problem to come up with the solutions to that problem and test it out as they go as part of a community, alongside peers that are going through a similar process. That's not a new idea. This is very much a pilot for us. And I think part of the idea for this is that we will, you know, when we originally got some money to try this out, the plan was that we would pan London, and then through that process could create a toolkit and an off-the-shelf plan for how this could be run at a more local level. So we mentioned earlier that one of the outputs of this will be if ICSs feel that this is an interesting way to work and they'd like to replicate in their local systems, we'd have an off-the-shelf series of documents and a process that they could use. So in this first instance, whilst Pan London is pretty expansive, and actually we've got a huge region, we wanted to make this quite focused. There are a ton of challenges that we are aware of that are systemic, and so we're looking for projects that are going to be taking a problem that is relevant to other areas of London. So at the end of this, we want to be able to showcase those 10 to 12 projects and hopefully inspire other areas, walk other areas through the process that some of the people that were successful in on getting onto the programme have gone through. And hopefully there'll be, not all of them will have had the desired impact, but for those that you know, there's value in sharing sort of the failure as much as there is the success, and hopefully there'll be some successes that can be replicated in other areas of London. So the first thing to say is that on this pilot programme with limited spaces, we'll be looking for projects that can really make the case that the challenge they are working on is a challenge that other social prescribing programmes, it's a common challenge, and other social prescribing programmes will really benefit from the process that those that are successful on getting onto the programme will go through. So we are hearing constantly from all sorts of people across the system key challenges in embedding social prescribing, making sure that it's sustainable and is definitely targeting and directed at the people that need it the most. So there was a lot of efforts going into social prescribing at the beginning to grow the teams, and right now we're seeing, as the targets for the caseloads that link workers are holding are going up, as the teams are growing, as PCNs perhaps are starting to manage link workers themselves or get more involved in directing the work of the link workers, not a lot of thought's gone into the progression for social prescribers. Perhaps there is a lack of support for social prescribers. Maybe not the right people are being attracted into the profession. And we're starting to see a real issue around kind of attracting the right people and keeping those that are really good. I'm always really, really humbled when we hold peer supports or peer learning sessions at the breadth of experience that link workers have. And I think we see it as our role sort of in thinking about the health of social prescribing across the region to really think about how can we keep some of these really excellent people working within the realm of social prescribing and making sure that it really thrives. So, and actually when we set this project up, we had 60 grand to deliver the project and hand out grants. And since creating this programme, we've managed to bring in another 60 grand, and that so 6 projects and that was specific to tackling the issues around recruitment and retention. So 6 of the projects hopefully will be very focused on recruitment and retention. So that is something that we have to meet as a requirement for our own funding of this pilot. So we're looking for 6 projects that are very focused on recruitment and retention. That's obviously very broad, and there's lots of things you could make the argument that lots of things that you're thinking about tackling will pertain to recruitment and retention. So a couple of other things that I think will be a priority, and as Molly said, that this isn't comprehensive. This isn't, you know, if somebody can make a case for a challenge that sits outside of one of these 3, we will consider it, but what we are looking for is something that is a collective challenge across London. But the other 2 things that we see constantly coming up is access and making sure that social prescribing is supporting the right people. There are a huge number, there's pockets of huge deprivation across London, and social prescribing initially was intended for those that are particularly vulnerable, and there is a risk that sometimes it can be allocated towards those that maybe are asking for it, or as Dan Hopewell, some of you will know Dan Hopewell calls it, the worried well. So making sure that social prescribing is genuinely reserved for those that are most vulnerable and are going to benefit from the extra support the most. And then the last but not least is impact. So I know talking about the value of prescribing, and whilst it's really sad to say that we're still having to do that 2 years on, I think it is very much still a basic challenge that has huge ramifications for the sustainability and the long-term success of social prescribing, is actually making the case, demonstrating that social prescribing is having a positive impact, and actually really sort of demystifying what the role of the link worker is, who they should be working with, and what benefit it has both for the patient population and also the National Health Service itself. So those are the three what we believe to be collective challenges that we can say are definitely a challenge that is spread across London. And so projects that are speaking to one of those three challenges are going to really, not only will it be beneficial for the participants that are taking part in this pilot, but the time that they spend in unpicking those challenges will be beneficial to the rest of London as well, hopefully by the end of the programme. Are there any questions on that at all?
I just wondered whether you wanted to give a response in reply to Jackie's comment in the chat. Have you seen it?
I'm just reading it now. Jackie, do you want to say something a bit more about what you've written?
So I suppose I just, for me, I mean, obviously I'm very fortunate in that we are a voluntary and community sector organisation hosting social prescribers. And so we're very embedded within the voluntary and community sector. And so so we haven't had issues with recruitment and retention. We've got a fantastic team. They don't leave. They're really happy working with us. They really know where they should be focusing their work. I just feel we're a really good exemplar project. What we're finding the biggest challenge is that everyone wants a piece of the social prescribers, and everyone wants them to direct people into community services, and that those community services are not being funded adequately to meet the demand, and that we're having to pace where we direct people and how we direct them. And, you know, and again, we can do that, but I'm worried that some of these services are going to fall over. And I appreciate that's not what this programme is about. But what I'm just nervous that we're just falling into this narrative of building these phenomenal social prescribers who are meant to be link workers. You know, yes, they work directly with clients, and most of our prescribers will work with people, you know, for in excess sometimes even of 12 weeks, you know, really to support them and to deal with a whole range of their needs. But nonetheless, they're all aware that their prime motivation is to support those people into community activity, away from medical pathways. And I'm just slightly nervous that that might get lost. So I just wanted to say that, because it really matters to me, because as a head of a CVS, my number one mantra now everywhere I go is fund the prescription. And yet this doesn't seem to be touching that at all.
No, well, actually, I mean, there's two things to say on that. Firstly, I could not agree with you more. I've come from working in the voluntary sector, and I see social prescribing, whilst it's an incredibly powerful mechanism by which to really treat people holistically, there is no social prescribing without voluntary sector activity or services, statutory services even, for link workers to be referring people onto. And if those services are not funded, then there is no social prescribing. It doesn't exist. So I see that as really that's the priority for social prescribing. And so us as an organisation, alongside other anchor organisations that are thinking about some of these things across London, are really committed to making that a priority for our work. So one of the things we haven't mentioned is we HLP have got a project to stand up community chests and engaging with local authorities and funders to think about how we can attract more money and really make the case for investing in voluntary sector activity in a way that is not only related to social prescribing, where using the insights of social prescribers as to what's needed and what's missing, but to actually I guess if the NHS are thinking that they want to send people onto these voluntary sector organisations to support them, they need to be putting their hands in their pocket as well. And so we've just recently had great news that across North East London, as a result of the Year Here project to explore what a community chest looks like in London, all boroughs in North East London have committed funding to this. So there's going to be a pot of about £500,000, and we are looking. It's our priority as an organisation to be thinking about how the NHS can be. One of the things we're working towards is a 1% commitment of the NHS budget towards VCSE activity. Now that's going to take time, and it's going to take partnership working, and that's very separate to this project. The other thing to say about this project, though, and so this project is more about kind of social prescribing also doesn't exist if it's not able to tackle the service issues it has and keep out a service across a load of different organisations that really are their own bosses. They may receive funding from the NHS, but ultimately they're private organisations who can work in their own way, and that's really tricky, even where there's an excellent voluntary sector organisation like yours hosting the link workers and can really make sure that the link workers are supported, invested in, have got consistency of service across the PCNs. They are still going into organisations that you're going to have to negotiate with their caseloads, and how often they go into surgery, and how they work with the patients, and how much time they have with their patients. On the subject of ensuring that the health service respects and invests in those voluntary sector activities, I guess one of the projects could be looking at what does it look like when we bring together when we pull out data and we start to make a case for the lack of services or the lack of investment in services, and we bring together a bunch of people from the local community to make a case for additional funding going into those, for better funding and more longer term funding for voluntary sector organisations. So in some ways this could be looking at the systemic issue whilst not directing funds towards voluntary sector activity. It could be looking at kind of what does the facility of bringing together a group of people to better fund the voluntary sector in order that it benefits social prescribing. Perhaps this project could look at that. Does that make sense? Does that speak to some of your concerns? Whilst we can't solve all those problems ourselves, like these are some of the things we're doing, and this is how I think this project could indirectly help that challenge.
Yeah, and I think using data.
Does that make sense?
Maybe running a project to use the data to evidence need and to bring people together to talk about how you then fund that need is a good call, actually. Thanks.
I think Amy also had a question.
Hi, yeah, thank you. Sorry, I got disconnected there, and what you were speaking about is very much in line with the question I had, so I'm sorry if anything I ask is sort of asking you to repeat what you just said. But basically the project idea that I've got would be looking at access, and in that sort of remit of, voluntary organisations and local organisations and the issue of funding. So I understand that obviously this application isn't about, funding for that, or it would hopefully increase it. But my idea is sort of looking at working with a voluntary service, and I'm just wondering if that is okay to sort of use that resource whilst not actually, doing it in the essence of working with them to, I'm trying to word it correctly. I don't know if you can get what I'm saying, but I would be looking at how link workers could be used more effectively with co-production to sort of, with the argument of increasing funding for these services, if that makes sense. And I just wanted to make sure that that would be all right to do.
Yeah, okay, a couple of things to say there. Firstly, kind of without answering your question directly, the a big, a message to everybody. The most successful work will happen when you are using the assets and the resources available to you, and that that will be in some cases the voluntary sector, in other cases it may be clinicians that are really passionate about your work. It might be commissioners that are wanting to really explore how to support particularly deprived communities in your local area. All the people that are related to the problem that you are trying to solve, those that are supportive of it and those that might potentially are contributing to the issue. It's really important that you're looking at all of those assets and resources when you're thinking about your application, because having a good understanding of all of those things and having good relationships with those that can really support this project is going to really elevate your work and ensure that there's positive impact. So definitely partnership working and collaboration with people that are pertinent to the positive outcomes and impact of your project is really important. So I don't know if that answers your question, Amy. I mean, I think definitely it makes a lot of sense. I mean, co-production with voluntary sector organisations, definitely music to our ears, definitely the sort of things that we're interested in hearing about. And obviously, someone's asked a question about the long-term plan. Social prescribing does feature in the long-term plan. It's one of the few things that has targets set aside it, and it is being mainstreamed through the R's money that is being allocated to primary care networks. There's lots of reading that went out on all of the stuff if you want to have a really good understanding about the context in which social prescribing has ended up in primary care. But I think in order for these things to really thrive and succeed, partnership working is really important, and that's been, whilst it's not come with very much guidance, we've seen the amendments to the most recent copy of the DES contract, in nudging social prescribing services or asking social prescribing services to reach out to key local players and working in partnership with them to think about how they're going to support a number of different patient cohorts. So definitely partnership working. It's a very long waffly answer to a question about partnership working, and hopefully the point that it's actively encouraged is coming across.
Perfect, thank you, that's really helpful.
Lots of really interesting comments in the chat. Can anybody else, is there another question? Ollie, was yours a question, or is that more an observation?
More of a comment.
Yeah, a good one. And actually, that is interesting, because I mean, I suppose I'm getting off the topic of our program now, but I definitely think so. I know that there are examples in other boroughs where the local authority, public health, will top up some of the money, especially on the managers' salaries, because they really see a value in having access to the data that the social prescribers are developing. And these are all kind of interesting kind of ways perhaps to think about this project. And I think the other thing to say, and I perhaps there's other slides, I think we've got some other slides that we need to probably move on to. I get the sense that this is I'm hoping that this is really speaking to people, and they feel that this is going to be a valuable program, not just for the money that you're going to receive, but also hopefully the skills and the being part of a community of people that are tackling problems in the same way, so that community of practice approach, and so that there will be probably a lot of really good applications coming through. It's going to be tricky for us to pick 12 whilst there is a really kind of like robust process that we'll be going through, and we've got external people that are supporting that. I suspect there will be projects that we will want to support making happen, even if they don't make it onto the programme. And so it's important to say that we will be talking to our ICS colleagues. We will be looking to where we can make cases for bringing in extra funding to support those that may not make it onto the programme, but actually have got some great projects there. We'll be doing everything we can to really ensure that all these fantastic ideas that are being explored will get attention and support to be made happen. I hope that makes sense. But this is a pilot. There are limited spaces, but we'll be doing everything in our power to make sure that all the projects that are putting time into making an application get some attention. Molly, I'm conscious of time and I don't want to take up. Have I missed any important questions?
There's just one more question from Amy in the chat. Can you read that? Or Amy, do you want to elaborate?
Yeah, sorry, I just wanted to clarify. I think it is okay, but I know this is directed towards PCNs. But I work in secondary care mental health. However, I do have clients that are referred directly from the GP, so they are under primary care. And I just wanted to make sure that although technically I'm based in a secondary care service, that it is still all right to apply for this.
Yeah, I think yes, absolutely. I think you're working within, if I remember correctly, you're part of a broader social prescribing service.
Yeah, so I work in Hammersmith and Fulham mental health team, but the link workers, we now do also accept referrals from primary care as well as those open to secondary services.
I think we'd be really interested to see your application. I think there was some questions earlier in some other sessions that we've run around whether or not there would be this could be used to take social prescribing out to other settings, and we decided that as a pilot we wanted to keep this quite focused on thinking about how to enable existing social prescribing services to really thrive. But yeah, so it sounds to me like you would qualify. Yeah.
Okay, great. Thank you.
Is the time devoted to the presenting and scaling the findings and measuring of outcomes of the project an extra role with our current SP role? I'm not sure I understand, Iram. Perhaps I'm being slow.
Sorry, so what I mean to ask is that let's just say if the funding is given for the project that I'm interested in, is that work that we do outside of our normal hours, or do we incorporate it into our working week? I'm trying to think of how we can effectively and realistically do that with the current workload.
It's a really good question, and I'm not sure one I could answer on your behalf. My sense is, so one of the questions in the application form is, have you kind of, how are you able to make time for this project? And I think whilst I wouldn't want to presume that you could juggle lots of plates and this could bleed into life outside of work, I think it's probably quite important that your work is supportive of the work of this of taking part in this project.
Sorry.
Yeah, no, go.
So I'm just thinking, as somebody said before, they're running SP with their VCSE service. So, would the manager then recognize that time is needed to do the work in the next 6 months? You need some time off to attend the meetings, and this can have quite an impact on how we plan our weekly timetables. So would the PCN managers and the VCSE leaders and managers would they then support us to sort of do the work if we're granted the money?
This is probably where it's, unfortunately, it will, those that have support from the people around them to take that time to join the sessions and come along are going to be unfortunately, are going to be in a more fortunate, they will be in a more fortunate position because they will have the time to commit to this. There is definitely, there's several half-day sessions to take part in and lots of other drop-in meetups. And I think to get the most out of the programme, we will be looking for people that have support to join as much of that programme as possible. So I think I can't answer whether or not all will be supportive of that. I think it's going to depend on your, who the leaders that you have around you. But I'd strongly recommend going to talk to the people who can help support you in ring fencing some time in your diary to take part in this program. And I think it's about, if you're tackling a challenge, if you can relate the challenge that you're tackling to having a positive impact on their day-to-day working life. If you can go and find a GP that's really struggling with, lots of very complex cases, and you feel that you can use that as a challenge to, you can tackle that, help support them in tackling that challenge, then perhaps you're going to have a better chance of somebody seeing the value in letting you out.
Yeah, I think what I just want to clarify is that I really don't see that it would be a problem for me, but so long as your program knows that we are doing this alongside our work, so we'd get the support from the PCN manager.
Looks like you've got an answer in the chat. Your manager's already given you the sign off.
Yeah. I just wanted to understand how it would fit in with current work. So yeah, thank you, Farhana, and thank you for answering the question. Thank you.
Molly, are there other slides to cover? I think there are.
We do have a couple more questions, but if it's okay with everyone, we do have time for more questions at the end of the session. So if you could just keep them in your mind, and we'll just run through the remaining slides, and then you will have time just to ask those again at the end. Jenny, could you move on to the next slide, please? Thanks. Okay, so we have created some marking criteria based on the application questions, so more based around your responses to your proposal. And this is what we'll really be listed here is what we're looking for from successful applicants. So we really want you to demonstrate a clear understanding of the challenges that you're proposing, so why you think they're a barrier and how this is widespread as well. Also, an understanding of the existing solutions to these challenges and why you think they're insufficient. We want you to demonstrate some thinking and some project management ideas really around sort of demonstrating ideas of goals or outcomes to your suggested solutions that are appropriate, feasible and achievable, and demonstrating ideas around project planning, deliverables and risks within the question around suggested solutions. We want you to demonstrate an idea of all of the resources and the people and partners that you need, that you think will help you to support in this work, how you plan to engage them, and on the back of that, an understanding of co-production and how you'll include this in your work as well. We want you to think about the impact that overcoming this challenge will have, particularly in tackling health inequalities and in work for the primary care networks. And we want you to have a bit of an idea of application information as well. So thinking about how you're going to measure the impact of your projects at the end, and thinking about how you'll collect data and analyse this as well. And then finally, we want you to think about how the learnings of the programmes will be shared and have an understanding of how this can support current priorities within the NHS. So just to note, if you think it would be valuable, we do recommend maybe reading up on some of this stuff just before applying. We do have some resources that we've shared at the end of the information slide pack for applicants, which is linked in these slides and on the HLP website. So please do go and check those out. There's some, for example, resources on co-production. Thanks, Jenny. So yeah, as I mentioned previously, the application process, so it's all online. It launched on the 22nd of June and it's open until the 20th of July. If you have any questions, you can get in touch with the HLP social prescribing email just listed there. And in terms of our expectations for those who do get onto the programme, so you need to be part of an organisation based in London, but as I mentioned in response to a question previously, we'll be looking for a geographical spread. This does not mean, however, that we need to have only one project from each ICS or borough. So projects also, we've alluded to this earlier, but they need to focus on solutions overcoming challenges faced to social prescribing service design or delivery. So we won't fund ideas related to voluntary community sector activities alone. It's really important as well that participants will be willing to share the outcomes and the learnings, and as well as your achievements from your project publicly at the end, as we will be showcasing all of your projects and your results in March 2023. It's also really important that all of the participants have the capacity required to commit to the 6-month programme. As mentioned, it's not just funding, it's really all about the programme and networking with the collective group of peers on the programme as well, just to get the best out of the support that we're offering. You must have a direct link to social prescribing and, as alluded to there, attend all of the mandatory sessions, whether that's just needing the project lead or all of the project participants. Next slide, please, Jenny. Okay, so what can you spend the money on? So this is a bit more guidance around the funding and what you can how you can think about breaking down the funding towards your idea. So we will fund anything going towards staff salaries. So for example, if your project requires a data analyst or organisational development and training. So if you do want to spend some more money on any additional training outside of the programme offer of support, so that might be additional project management training. Any equipment, so for example, if your project involves creating a short film, the camera equipment, small scale refurbishment, any running costs or additional project activities. As mentioned as well, it can't go towards funding the voluntary community sector activities alone. Any activities that replace government funding, political activities, retrospective costs, so those are costs that you've made prior to joining the programme, any loan repayments or activities that generate profits for private gain. Next slide, please, Jenny. So we do appreciate that if you're coming to the programme and the application form with a bit more ideas around the challenge and really focusing on the challenges rather than focusing on an agreed solution at this stage, it does make it more difficult to break down the funding of your project. So we have given some steps just there and some ideas of what you can start to think about. So as part of the application, as I said, we will be asking you to think about the potential solutions to your challenge or challenges. And so you can really start to think about what these solutions may require. And we've given a breakdown of how you can start thinking about this just there. So that's everything on the application guidance. Are there any other questions? We can move into the Q&A section now. I'm just going back over the chat.
There's a question coming from Frank Hamilton. Frank, do you want to take yourself off mute and just say a bit more about your question?
Yes, sorry about that. I took a bit of time doing that. Yes, so I work as part of the Confederation supporting primary care networks. We've got an organisational development and training hub, and because we support each PCN and there's budgets for each PCN which we support, there's backfill costs. So I just wanted to say, does the funding allow for backfill costs? So if the social prescriber is not working in the PCN because they're on a training program, can that cost be covered?
Liana, do you want to take that?
Yeah, I'm happy to. So your question is, the link worker is going to be taking part in this programme. As a result, they're going to need somebody to cover their work in the PCN. That might
Correct.
be 2 days a month for 6 months. Can you put that down as a cost? Yes, you can.
Correct. I know it as backfill costs. I don't know what term you would use, but I know
I
it's
wanted to
backfill.
make it really clear for everybody, so everyone can benefit from your question. So
Okay.
if a link worker, in order to make sure that the link worker's time is not compromised at the PCN, and somebody else might be covering their time whilst they do this project, and there's a staffing cost, then absolutely, yes, you can use that.
Thank you.
I mean, obviously, the most important thing to say is that you know, subject to their project being kind of like meeting all the other criteria. Yes, of course. In order to take part in the project, there is obviously going to be a staff cost.
Thank you.
Thanks, Liana. Kim, I think it was, had a question earlier. Do you still have a question?
Hello. So you can hear me?
Oh, yeah, just heard you.
Yeah, okay, perfect. So my question was, let's say, for example, if the program I have and the grant is approved, who will receive the funding? Will it be the Federation or the PCN? Or who will it be allocated to?
So the funding will be allocated to the project lead. So anyone who's leading on the project, it won't go directly to the PCN. Liana, do you want to add on?
Well, I mean, I wouldn't say that it definitely won't go directly to the PCN, because it might be that it really depends on you. You're making the application where you tell us where the money needs to go. I think, again, the most important thing is that there's a really clear understanding of how the resources and money are going to be spent. And I think we kind of alluded to this. It's because you don't know exactly this is taking a quality improvement approach. We're not expecting people to come with this is quite different. We're not expecting people to come with fully formed project ideas, you know, for what is exactly the solution going to be. So there was another question around that we've had in other sessions around how will the money be allocated and where will it go. It's really up to you where it goes. You'll be making a case for that in your application. And I think it makes sense for the money to be released in 2 amounts. So one at the beginning of the project, and then another a few months in, once you've got a bit of a clearer idea about what your solution is going to look like. And that's going to impact on how the money might be spent. So I think there's we'll be looking. You'll have an opportunity to outline this some more in your application. Does that answer your question?
Yes, perfect. Thank you so much.
Hayden.
Morning, everyone. Thank you for this well-explained presentation. But my question is, I am a social prescriber link worker, and I do work for a Redbridge PCN, one of the PCNs in Redbridge. Is it okay? Because the issue for me is that I know the space is quite limited and the project is a pilot project, but for me it is, in essence, my focus will be, and as well as my colleague, it is to address an inequality, and it is quite simple. And the solution, and so what I'm saying as a project is that, will that have a fighting chance, if that makes any sense, if we create a really innovative issue for like a common issue? Will that stand out, or what are the key things would you be looking for in an application? Although additionally to everything you have explained, I hope I'm being clear in my question.
Could I take that one, Molly?
Yeah.
Hi, Hayden. I understand. I think if I understand what you're saying, it's, you know, you are link workers that are sort of in a PCN. You haven't got big organisations sort of like around you. You've identified something you want to tackle. You've got some thoughts on how you might go about doing that, and this programme may enable that. I would say you've got a fighting chance, absolutely. But the other thing I think we want to hear from not only do we want a geographical breadth of projects, but I think it is really important to, you're not the only link workers that exist within a PCN on your own without you know, organisations insulating you. So yes, that in itself is an issue in the delivery of social prescribing. And so if we can support really exciting projects that can be replicated and other, you know, useful for other link workers that are in a similar situation to you, then definitely that would tick a lot of boxes. But the other thing to say is I think everybody should, you know, anybody that is interested in this approach and interested in this programme should make an application, because it will really help us make a case for this in the future, for ICSs to take this on, or for us to run this again at a much bigger scale. And also there will, for all those projects that aren't successful on getting onto this pilot, we'll be advocating and thinking about who we can connect them up with to see how we can make these things, make some of these projects happen outside of the programme as well. I mean, obviously subject to, however, our capacity, but I feel very strongly that if someone's putting in an application, we should be supporting and helping them think about how they can make that happen, even if they're not part of the programme.
We just have another question from Nick.
Do you want to take yourself off mute, Nick?
Hi, yeah, I just wondered if we were exempt from applying, given that we're a charity, even though we've kind of been commissioned by our local public health to provide a link worker service, social prescribing service for early years.
Can you say a bit more about the challenge that you're likely to tackle?
Yeah, well, we were looking at access in particular. I think we've created a co-production network called CoCo East, and we're looking at ways of reaching hard to reach groups, and we're linking the two things together. So our kind of co-production network and our social prescribing work.
I think that sounds like a really exciting and interesting project. My honest answer, whilst I don't want to discourage anybody from applying, that sounds very kind of akin to the access issue. My only concern is that it is probably sitting outside of primary care, so I'm not sure how replicable it may be. But I'm also tempted to say, yes, you're not sat within primary care, but like Amy's example previously, I'm sure the thing that you're proposing to tackle would be beneficial to other social prescribing services. You've stumped me there. I'm going to say put in an application.
Okay.
But if you've got any questions whilst you're filling out that application, then please don't hesitate to contact us.
Okay, will do. Thank you.
Can I just ask actually quickly on that, Nick? Do you have any connections with primary care, or in terms of where you get your referrals from, or any support?
Well, I might ask Kerry Cooper, is my colleague who's actually running the service. She's better placed to answer that. Kerry,
yeah, we do. We get referrals from GP services. We get referrals from actually the wider social prescribing team. I sit on their group, so within the week, within the year programme that we've got, I'm actually part of their team as well as their own team. So yeah, I'm quite involved with PCM. I think you'd need to make the case in your application about the connection to primary care. So I think it's a valid application if you're making that case. Cool, thank you. Brilliant.
Thank you.
Are there any other questions from anyone?
Is everyone dying to go and watch Boris Johnson hand his notice in?
Yeah, I'm sure we've lost a lot of people. Hakim, sorry, do you have a question?
Yeah, just last question. Once you have filled in the application, you have applied for the grant, how long is the procedure?
So sorry, is your question, when are you likely to receive the funding?
Yeah, that's right. So what is the time frame?
Yep, so in terms of the funding specifically, we will offer this to you in 2 split payments. So you'll get the first amount at the start of the programme, and then we'll give the other half at halfway through the programme as well. But there is opportunity for you to request it at different times, and we'll offer this on a case-by-case basis. If you're asking more about the procedure in terms of the application and the process throughout the programme, that was just shared on the slide that Jenny shared. Thank you. Yeah, so launching 22nd of June, deadline is the 20th of July, and then we'll communicate out the outcomes 8th of August. Deadline for accepting 15th of August, and then with a view to launching at the start of September and wrapping up end of February, and then showcasing your results in March. But does that answer all of your question?
Yes, sort of, but yeah. Thank you.
Sorry, do you want to elaborate a bit more if I haven't?
No, it's fine. It was just regarding the application. So once, yeah, it's kind of answered it, so I can see the time frame. That's fine. Yeah.
Yeah, so with the application, so if you can submit before the 20th of July at midnight, as that's when the applications will close, then we'll have a brief clarification period where we'll be marking all of the applications, and then you'll receive the outcomes, so whether you've been successful or not, the week commencing 8th of August, so any time that week.
Yeah, okay, perfect. Thank you.
No worries. So Sadia, sorry, is that how you say your name? Do you have a question?
Yeah, perfect. Yeah, I do. I was just going to ask about the actual application form, because it's only a 10 grand pot. Yeah, it's, you know, we spend time doing big bids and tenders or whatever, but it's a 10k pot of money. And I just hope that the application form reflects that. Yeah, because, you know, all our services are pushed. We do want to apply. We do think the themes are really good and have a good idea to do to tackle a challenge that we face in Tower Hamlets. But I just want it, you know, because sometimes you can get applications and for, you know, they can be quite long and time consuming. So I just want to know whether it's going to be a form that reflects the amount of money that we're applying for.
Yep, great question. Thank you. So yeah, just here Jenny's shown like all of the different questions that are included in the application form. Can you see that okay?
Jenny, I think your computer's gone a bit funny. You might need to take down the slides. Oh, there we go. Yeah.
There we go. Thanks. Yeah, so it should be quite quick. The main body of the application is section B, so that's a bit more qualitative, where you'll have to really sort of write slightly longer answers, but they're all mostly short answer questions, and they're just really to get you thinking about the challenge and to get us to understand more about your thinking process and your ideas for potential challenges. And yeah, and then the second half is section D, so that's also quite quick. Most of the questions, half the questions are quantitative, so more of a scale, so it should be quite easy for you to get through all of that. But if you do have any concerns when submitting the application, feel free just to send an email to hlp.socialprescribing@nhs.net, and we can help to support in any way as well.
Thank you. I think I'd just like to add to that that I guess what this isn't it's a small amount of money, and I definitely, the intention was that the application would be reflective of that. But I guess if the main reason that people are going for this is the money, it's probably not going to be a successful application. I think the real point of this is it's about kind of there's more value to this than the money, and it's about kind of the skills that and the process that somebody's going to go through into taking part in the programme. So if the money is almost sort of a bonus and an enabler to explore a project idea rather than it's funding towards a project, if that makes sense.
Faye, do you also have a question?
Yeah, it's just a very quick question. It's just a bit more of a logistical question. You've said that the outcomes obviously will be known by the 8th of August, with an acceptance being expected by the 15th of August. Just if the person involved in putting in the application and the project is on holiday during those times, is it okay to put someone else? How does that get handled? I know small team, not enough oversight, you're not practically available as it's the summer. How would that impact on the application? Is there a possibility of delaying an interview? Because I think I did see that there would be an interview as part of the accept. Is that right? Depending on if you're given the offer of the project.
No, I don't think there will be any interviews. There's just a short clarification period. So we'll be communicating all the outcomes out just after looking through the applications and putting this to the decision-making board as well. Obviously, yeah, completely understand if you are on holiday and if you're applying as an individual, you can just get anyone supporting you on your partaking in the programme can just email us to let us know that you might be taking a bit of time to get back to us on the name of your group, if you are coming up with a name, as that's also part of getting back to us on the 15th. But yeah, if you do need a bit of a delay, I think just if anyone who's supporting you can email us on the email just provided there, so hlp.socialprescribing@nhs.net, and let us know, then we can obviously account for any delay in getting back to us.
Okay, no, that's fine. I think if it's digitally accessible, then that's not a problem. It was just in the instance of it required a panel interview. I was thinking, yeah, that's a little bit more problematic, but it seems to me as if it's quite a straightforward process. Thank you.
Perfect. Well, are there any other questions? Okay, well, if there's not any others, we are just finishing 4 minutes before 11, so I'll give you 4 minutes of time back. But thank you so much, everyone, for joining. I hope this has been a really successful session for you today, and I hope you're excited to apply. We're really excited to get all of the applications. I think it's going to be a really amazing and exciting programme, and hopefully get some really great projects out of it at the end. So yeah, thank you all so much, and thanks to Charlie for all of his support with the interactive session as well, and Jenny and Leanna for supporting as well.
Thank you so much.
Thanks a lot.
Look forward to reading your applications.
Yes, thank you.